Hello and welcome to another episode of The Health Quest by Betty Oketch. In today's episode, we will major on obesity and be able to try and understand why it is a problem in our health system and what we can do about it. With me in studio today, I have a very pleasant guest who will be introducing herself and telling us more about what she does. Welcome, Dr.
So thanks, Betty. Thanks for this opportunity to discuss a subject that is becoming more and more known. My name is Dr. Nicola Oketch. I am a consultant physician and endocrinologist, and I'm also an upcoming obesity medicine specialist.
Wow. Did you guys know there's something like that? I don't think most of you know. But yes, we now have specialty in obesity, just to tell you how much this is actually a problem in our country. So to start us off, I would just like to ask you, on March 4th, we celebrate World Obesity Day. Do you know why we celebrate this day? Would you like to share that with us? And in your opinion, do you think obesity is a problem that we need to be addressing in Kenya?
Yeah, so obesity is definitely a problem. 4th March was actually chosen by the WHO just to be able to bring obesity to the fore, because the rates of obesity are increasing globally and even locally, and we are not anywhere near managing the obesity. So it's to bring it to the fore and make it a conversation that we have either as the medical professionals or even just as laymen to be able to manage obesity and hopefully reduce the rates of obesity globally and locally.
Great. And for those who are listening, they're probably wondering, at what point do you say someone is obese? At what point do you say someone is overweight? Is there a difference? Is there a way you could define it so that the listener could be able to understand?
Okay. So what has traditionally been used to determine whether someone is either overweight or obese is the BMI, the body mass index. Although it is currently now known not to be a very good measure of either being overweight or obesity, it's still used more commonplace than any other measure of determining person's weight. So body mass index is just a formula that's used to calculate the weight over the height of the person and to determine where they fall on the scale of weight. So a normal BMI is anything between 18 to 24.9 kilograms per meter squared. And anyone who's considered overweight would be between 25 to 29.9 kgs per meter squared. And then anyone who's obese would be above 30. Now, there are grades of obesity. It could be grade 1, grade 2, or grade 3, depending on how severe the weight is.
Okay, that is very interesting. And so if someone is overweight and they want to say that maybe, you know, where I come from, people are this big, so I don't agree with the BMI as a measure. Is there any other means that we could use to determine if that is now a health problem or they're still obese or overweight?
Okay. So basically speaking, on BMI specifically, there are actually race or ethnic different BMI cutoffs. Unfortunately for us in Africa, we don't have our very own. We rely basically on Western literature, Western facts. So we use their BMI cutoffs, but we know Asians have a lower cutoff. However, as I said, BMI is not a good determinant. So what we tend to use sometimes is your waist circumference. So waist circumference is a good indicator of how much fat you have inside your belly. And for us, we know that fat inside your belly is the one that is dangerous, that could lead to problems. So for ladies, ideally your waist circumference should not be above 80 centimeters, okay? For men, your waist circumference should not be above 95 centimeters. So if you're finding that you're anything over that, then you need to really look at yourself and do a bit of changes to your lifestyle probably and seek help to manage your weight. In addition to that, there are other traditional things that have been used. For example, the mid-upper arm circumference, more often in children, and other things like the skin thickness to be able to determine how much fat is there. Right now, there are other more advanced ways of measuring the composition, body fat, and muscle density of a person. So we use something called body composition analysis. That one has become more and more available, and it's actually available locally. It's the best indicator, especially if someone comes to you and they want a program to deal with weight management. On the more advanced scale, then we would do what we call a DEXA scan, which is basically a scan that tells us about your fat percentage, lean muscle mass, your bone health, hydration status, and all that information which you can use in your management plan.
Great. I was actually getting excited when you said we do not have a cutoff. We do not have our own African BMI, and I was like, finally, they cannot group us all together. But then you have clearly indicated that there are other means. And the most common one, the waist circumference, as you speak about it, seems to be very simple, but yet very effective. Because I know people who will say, you know what, we're not going to worry about this body. When we go to heaven, we'll have a new body. But that's a story for another day. Do we have numbers? Do we have numbers in Kenya to just tell us this is the population that has obesity and where they are distributed regionally, maybe which county has got more persons with obesity? Do we have any research to that?
So
that
we
side?
do.
Yes.
The one that I am aware of is the Kenya Demographic Health Service. There is one that was done in the year 2022 that showed that our rates of overweight and obesity are actually approaching around 30%. So 1 in 3 people are walking around with excess weight.
Whoa.
And that demographic survey actually showed us that women are more affected than men. Of course, for us, we know that we actually appreciate when a woman is well endowed,
well carved.
Yes, but in the medical profession, we know that that could be a risk factor for certain issues. Now, when we talk about the specific regions, urban regions are more affected than the rural regions for obvious reasons, because we are leading a more westernized kind of lifestyle. We are less physically active, we eat a lot of processed foods and things like that. But when we look at the specific counties, Nairobi would be the highest, and then now followed by Central and Coastal Province. So those ones are the ones that tend to have higher rates of overweight and obesity, at least in the Kenyan country.
Nice. Does it have anything to do with how much money a region has? Because it seems like if Nairobi and then Central are following, anyway, I'm not saying anything. So what are some of the causes of obesity? I know you have alluded to physical inactivity and maybe not being able to eat very healthy, but are those the only causes of overweight and obesity?
Okay. So overweight and obesity is multifactorial. That's something that we really have to remember, because you can't just say I'm going to manage my weight by eating better or exercising and that is going to drop. We have to look at the person in totality. So there are very many other factors that we know could play a role. We in the medical profession always have to screen our patient for other conditions that could lead to obesity. So there are hormonal conditions like people who have thyroid disease, particularly if your thyroid is working less than usual, what we call hypothyroidism, they tend to gain a lot of weight. And then there are other hormonal conditions like conditions related to your steroids, that cortisol levels, when they are very high, it could lead to a condition called Cushing syndrome, which is associated with high rates of obesity. There are some ladies who come to us with issues with fertility, and you screen them and find they have what you call polycystic ovarian syndrome. So you do have these ladies with polycystic who are also overweight or obese. So, and then the other thing that is more common these days is diabetes. We find a lot of our patients, particularly those who have type 2 diabetes, most of them are on the overweight or obese scale. Now, aside from medical conditions, the other things we really need to look at, we have to look at the kind of medication you're taking, because we know there are some medications that could lead people to gain weight. Medications that are used to manage psychotic conditions like depression or mania, those could lead to weight gain. Contraceptives, especially the hormonal contraceptives. So ladies, be aware of that. Hormonal contraceptives can make you gain weight. There are some medications that are used for managing blood pressure, which have been associated with increased weight. So that's in terms of medication. And then, of course, we also have to look at, just as you mentioned, diet and exercise. How is your diet? How is your physical activity? Sleep. Sleep is very important. So
and we don't sleep in this country.
And we don't sleep in this country. Everybody's running around and bragging about how little sleep they got. But there's an optimal amount of sleep that you should get. For us adults, it's between 7 to 9 hours straight. And
still be able to survive the Nairobi
because
lifestyle.
You can only function if you're optimal mentally.
But some of us say we can actually sleep for only 2 hours and still function the next day.
At the end of the day, that accumulation of lack of sleep is going to affect you. So sleep is an important factor when it comes to screening for causes of obesity. And then lastly, eating disorders, because the eating disorders we are aware of are anorexia, which you eat less, or bulimia, where you purge, where you eat and then you vomit.
Yes.
But there are other eating disorders where you binge eat. So someone can eat food for 48 hours within a 2-hour period. So they binge eat, or people who wake up at night, what we call night eating disorder, to eat food. So they eat a lot of food at night and also eat a lot of food during the day. So that cumulatively leads to a lot of weight gain, because there's no calorie deficit at the end of the day.
So actually they're taking in more and not probably using very little just to keep them alive.
Exactly.
And you didn't mention, I think you just passed over it. What's the role of alcohol in all this?
Oh, alcohol has a big role, and unfortunately it's a big thing that our society is embracing. I don't know, there's a lot of alcohol intake. Alcohol is basically empty calories, and when we say empty calories, it means that it has no nutritional value, but it's just making you gain more weight. So the more alcohol you take, the more likely you are to gain.
Or what if somebody is taking, let's say you're not taking beer, you're only taking the liquor, the hard drinks. Would you still gain weight with that?
You would still gain weight. You would still gain weight.
So what do you want people to drink? Water?
Preferably, yes.
We'll have that discussion in another episode. Great, and thank you for that. Now, there are people who actually say that, I think I come from a family that people are just obese. It's in my genes, and there is nothing I can do about it. Is that a myth, or is that a misconception, or is it actually factual?
So I'd say it's a bit of both. There is a genetic predisposition to being overweight or obese. One of the factors that is very important in that is the environment when the child was in the womb. So that environment that the mother creates when the child is growing in the womb also influences whether this child will be obese. I can give you an example. For example, if a lady lives in the rural areas or in an arid area where there's limited access to food, and she gets pregnant, that baby will grow up with a genetic makeup where they have a thrifty gene, meaning that they are trying to conserve the little food that they get. So if this child grows up and then moves to an urban area where there's a lot of fast food, you see the body will always be trying to conserve. Still retain that memory of having a thrifty gene. So this person gains weight because they have been exposed to an environment now where there's plenty. And though the gene is still there, the gene makes them conserve all the food that they take. So there's still that genetic component. However, there's also the nurture part. So there's nature and there's nurture.
Yes.
So how the family behaves, how you eat. Do you eat in front of the TV all the time? It's not mindful. You'll definitely eat more than you require.
Yes.
Okay. Are you the people who are always ordering in food in your family? So there's also that environmental influence. So it's not necessarily just only the genetic makeup, but also how you grow up that influences how everybody in the family gains weight.
And probably also just looking at your family and seeing that everybody is big and you get comfortable in that space. That's all you know.
Yes.
Until somebody decides, let me break this, let me exercise, let me eat healthier.
Yes.
And they start losing weight, then we realize the gene had very little role to play.
And just to mention, there are also genetic causes. So specifically, this is pertaining to children who are obese. So they have some certain problems with their genes, not necessarily because of the maternal environment, but that makes them gain a lot of weight even during infancy. So this is completely separate from that nature or nurture aspect. So there are genetic causes to gaining weight as well.
Okay. So should we consider obesity a disease like any of the other chronic diseases that you're talking about? And if so, then what are we doing to try and treat obesity?
So obesity is now considered a disease. It was actually classified as a disease very recently. And the reason why we classify it as a chronic disease is because people will manage it over a long period of time. And even at the point where you get to your ideal weight, you still have to do those measures to prevent you from gaining back the weight. Now, the reason why we are very concerned about obesity is because of the risk that it carries. Obesity is associated with very many other conditions: high blood pressure, diabetes, various forms of cancer, mental health issues, physical inability because your function is reduced. You see these people who are unable to move because of the amount of weight that they carry. So there are multiple things that occur as a result of obesity, and that's why it's important for us, not just as medical professionals, but also as laymen, to take into consideration the fact that we need to manage weight issues, especially starting from our children, because an obese child grows up to be an obese adult. So we have to start from there.
Hold that thought right there. We will be back after this short break. Hello, my name is Betty Okere, a clinical dietitian and diabetes educator. Brookside Plus probiotic yogurt provides you the goodness of good bacteria for a healthy gut and a good immune system. Probiotics are live microorganisms that can be added into our food or into our gut system to help us be able to maintain a healthy balance, thereby promoting good health and supporting our immune system. Brookside probiotic yogurt, you can use it in any form. Add it to your smoothies, drink it off the glass, and you will be able to enhance that healthy digestive system. Welcome back. If you're just joining us now, this is Health Quest by Betty Okere. And today we are speaking about obesity. And who better than to have Dr. Nicola Oketch, a physician, diabetologist and endocrinologist, and an obesity specialist in training. Dr. Do we ever look at children and see them as obese, or everybody wants this chubby, nice-looking child who has, they just look mushy, they look like you can pinch them a bit. So how then will we be able to know that where this child is headed is actually a problem, and therefore we need to watch out before they become an adult who has overweight or obesity?
Mainly it's the growth charts. Usually when children are very young, they have this regular attendance of the pediatric clinics, and there's a growth chart. So it's the growth trajectory, how you see their line is going. Is it going very acutely all the way above the 95th percentile? Then you'll know this child is probably headed in the direction of becoming either an obese adolescent and probably in the future an obese adult. So it's just looking through the growth charts and be able to see.
Okay. Yeah. So you earlier on spoke about the lifestyle interventions and what we can do about that. Do we have treatment? Do we have treatment on obesity? Is there any medication that can help us to be able to tackle this disease called obesity?
Yes, medications are there, but the foundation of all kinds of approaches to managing weight is always lifestyle adjustment. So I always emphasize, even in my practice, that my clients or my patients have to have that lifestyle intact, because at the point where they stop the medication or they have had the surgeries after a long time, then there's a risk of weight regain. Having said that, yes, the medications are there. There are pill alternatives, so there are pills that can help manage weight. There are some which suppress your appetite. There are some which prevent absorption of fat from the intestines. And then, of course, there are the injectables. What is becoming more and more known right now is the Ozempic.
And everybody is going for it. And unfortunately, these people are getting some of the medications, especially the injectables, without the consent of a healthcare professional. They're actually carrying them in suitcases, and everybody is injecting left, right, and center. So I think, yes, treatment is available, but we need to do something about it, because as you rightly put it, if you lose the weight, but the discipline to stay within your correct weight is not there, you have not mastered the art of trying to stay healthy, then it is an exercise in futility.
Yeah, and I must mention that with the Ozempic and Ozempic-like medications, just as you rightly said, you have to be an ideal candidate. Not everybody is a candidate for Ozempic, and that's where we get it wrong. Because you have to be screened. There are certain contraindications to giving Ozempic. Not everybody is eligible for Ozempic. And even when you do start, you always have to monitor your patients. One, for the side effects, because they can be severe and debilitating. And then secondly, because these medications suppress the appetite, to make sure that they're getting their adequate nutritional and caloric intake, even as much as their appetite is suppressed. So when you take Ozempic, I advise people who are watching, please take it under the guidance of a medical professional.
And even as they do that also, is to look at we all want to lose weight, but you really must be very careful about the kind of weight you're losing. You could actually end up losing your muscle, and yet you're already above 40. And we know what happens. By the time you get to 40 and heading towards aging, I know so many people do not want me to say that, then your ability to actually maintain that muscle mass that you require is reduced. So if you're going to use a medication that will help you stand on the scale and see that your weight has gone down, but in essence you have lost the wrong weight, you might actually never be able to recover it. Yeah, so that is something that people really have to look out for, and just ensure that whatever you do, whatever you choose to pick, there must be a healthcare professional qualified to be able to follow you up. And apart from the challenges of, as we have mentioned, that people get their medications from anywhere trying to lose weight, what are some of the other challenges that we face in the treatment of obesity? And especially for a healthcare system like ours, where we are pretty resource limited, if I may say, by design, but yes, we may not have all those resources. Even just to be able to assess and ascertain that a patient requires this kind of help. So what are the other challenges in that area?
So I'd say the main challenge, I think, is cost. One, cost in the sense that most of the time when you're approaching a healthcare professional for management of weight, you'll be approaching a specialist, or at least someone who has a specialization in that category of management. Yes, general physicians, general nutritionists can help you, but you really need someone who is well trained and who is well versed in managing weight. And most of the time we know, or rather not even most of the time, all the time we know that management of weight is multidisciplinary.
Yes.
So you will need to see multiple specialists. And that's now where the cost implication comes in. The other thing is, of course, maybe in terms of access to the kind of tests you want to do, they might not be necessarily available everywhere. So just that access. And then the other challenge on our side as the medical professionals is the know-how. How to approach a patient who's come to you specifically for weight management. We can't just lump them and say, go and eat properly and exercise. So you have to really look at your patient, every single detail of their history and their physical exam, to be able to know the best approach, because it's not a blanket approach, it's individualized. Every patient has their own individual plan to manage their weight.
And of course that takes time, and if it takes time, it definitely costs. It will have to have a dent in your pocket. But well, for a better tomorrow, are there policies that you think, in your opinion, should actually be adopted by the country to ensure that, yes, we can treat obesity, but how about preventing it? What are some of the things that we can do to ensure that it's embedded in our policies to prevent, to have strategies that can help us prevent overweight and obesity?
So when we think about prevention, of course, education, starting from schools, our primary schools. So I know some schools, like for example, in my son's school, they emphasize that they should not carry junk food for snacks. So healthy snacks. So emphasizing on healthy eating right from the primary school level up until university, and giving access, of course, having that access to healthy food. If you go to a vending machine right now, you will not find
there are no apples.
There are no apples. There's
Soda
basically no
crisps.
water.
Yes.
You'll find chocolate, you'll find crisps, you'll find cookies, okay? You will find ice cream, but you'll not find a healthy option. So one, education. The second thing is to ensure that we are availing areas or open areas where people can access or rather do physical activity.
But there's crime. We all fear running outside because
and
we'll be
safety
mad.
is a part of it. If you look through many obesity modules in terms of learning, they always talk about the built-in environment. So it's just about, not just about accessing open spaces where people can do physical activity in terms of just an open field or even like gyms which are affordable, but also ensuring that it is safe. You don't want to go running and then you're attacked on the road, okay? And then the other thing, of course, is to reduce or put policies or increase taxes for sugary foods and high-fat or ultra-processed foods, so that it makes it less accessible for people and they are able to choose more healthy options. And on the flip side, making healthier options available and affordable for the patient.
And of course, even just as simple as labeling the food, so that by the time somebody is making that decision to pick food A and not B, they actually have all the ingredients displayed with how much, what the quantity of those ingredients are in that particular food. And so they make an informed decision.
Yes.
And something else that keeps on ringing in my mind in terms of policies for obesity, or policies against, policies that would help us improve on our strategies to reduce and stop obesity, is being able to embed in the curriculum some of this knowledge. Like, yes, we have educated the public, but even in our school system, I know the CBC is trying to do that in terms of nutrition and introducing a bit of that, but to embed it at every step of the education for these children.
Yeah.
And also just have regular screenings. Schools can just say, we are screening our staff, we're also screening the children, of course, with consent, so that we are able to pick it when it is quite early. Yes.
True.
And when we're looking at individual households, what would households actually, what would you suggest they do so that they try to ensure that the obesity from one generation does not cross to the other one? I have an example of when somebody delivers a very big baby, it is a celebration, versus when your baby doesn't look that big at birth. What are some of the things that the families can do?
So, of course, it begins with the education, recognizing that a big baby is not always an advantage. If you have a baby who's 5
My people
kgs,
will kill you.
if you have a baby who's 5 kgs, you might celebrate it, but we know for us it's not a very good thing. And then, of course, just the parents have to lead. So there's somewhere that says children learn what they live. So if the parent is someone who is always used to eating in front of the TV, always used to ordering food, the children will also adopt that, because for them now they see it as something that is normal. So the parents have to lead in adopting a healthier lifestyle in terms of what they eat and how physically active they are. So moving, segregating specific times when you can move, doing it as a family. So for example, you say maybe on Saturday we'll go with the family and walk in Karura.
Where will the cars be?
Yeah, so just trying to adopt a healthier lifestyle. And then, of course, teaching your children, or even learning yourself, just as you said, how to read food labels. When you go to the supermarket and your child asks for Oreos, you will tell them, let's read that.
Yes.
Let's read that label. Versus telling them to read something else, maybe crackers, maybe they have less, So just looking and trying to use every opportunity to teach each other how to live a healthier lifestyle.
And probably as parents also just involve our children more in outdoor sports. I always have a rule in my house: if you eat my food, you must use it outside. You're not eating my food and then using your fingers to play. That one is not admissible. Sounds very bad, but then it gets people to play. And also, I know some schools, and even now we have sports academies where people are actually having areas and sessions where their children can actively participate in sports. So that those are all ways and means in which individuals and even families can help to keep this menace out. And lastly, what would be your parting shot? What would you like the public to know? For any person who is still thinking, well, I come from this community, I must look a certain way, and this weight thing is a Western far-fetched idea. What would be your parting shot for such a group?
So I'd say I have two parting shots. One, being obese or being overweight, it's not just about the lack of willpower. So it's not just about I'm not disciplined in how I eat. It's not just about I'm not disciplined in how physically active I am. There are various other factors that need to be explored. The second thing is, let us be sensitive to those people who are living with overweight and obesity. There's a lot of stigma associated with labeling someone as being obese or being overweight. They go through a lot, these people, and most of them have struggled with trying to lose the weight. Let us be more empathetic and let us help them even in their journey, because the journey of weight loss or weight management needs social support. You cannot do it alone. I cannot eat healthily if my people in the house are not eating well. So those are just some of the things I want to emphasize.
Thank you very much. And that was such a pleasant discussion. We definitely cannot have enough of that, and I'm sure we'll be calling you in future for other sessions on just weight-related issues and how that affects our health. And thank you for being our guest today on Health Quest by Betty Okere. We hope to see you again in our next episodes. You are also welcome to share your feedback with us on our social media platforms. And until next time, it's bye for now.